Good evening, everyone, and thank you for joining us tonight. My name is Isabel Lalma, and in the next 45 minutes, I will tell you something more about the potential of probiotics in our dental practice. This lecture is really aimed at all dental professionals, since the possible applications of probiotics in dentistry are quite diverse. They can be used by all of us, regardless if you are now a dental hygienist, a general practitioner, or even a dental specialist. I want to start with introducing myself. As I already said, my name is Isabel, and in these strange times and with this specific webinar system, sadly we cannot see each other. So I made at least sure that you could see me. Here am I. So now you know how I look. If our paths cross in the future, at a conference, a lecture, you know who you can go to with all your questions about probiotics. At this moment, I work part-time at a private practice called Quadrant in Leuven, Belgium. Additionally, I also worked part-time as an adjunct head of clinic at the University Hospital in Liège, where I'm also involved in teaching and research. Until recently, I worked for the KU Leuven, where I conducted my PhD, Untitled Pro-Microbial Strategies to Combat Biofilm Diseases. This is, of course, where I became familiar with probiotic research and conducted several clinical studies about this topic myself. Well, enough about me now, and let's go back to the reason why you are really here, to learn something more about the use of probiotics in your daily dental practice. If you go back to the title I chose for this lecture, namely, the potential of probiotics in the dental practice, the first important part of this title is, of course, the probiotics part. We may not always be aware of it, but probiotics are in fact all around us. If I ask all of you now to search as quickly as possible a probiotic product in your house or in your practice, wherever you are watching this right now, I guess the product that will turn up the most will be this: Yakult. Or at least something comparable, a yogurt or milk drink. However, probiotics are much more than just dairy products or products used for gastroenterology. At this moment, the probiotic market is worth billions. And we have all kinds of probiotic products, as you can see here. Of course, the most well-known, the most well-researched, and the classical probiotic products are still the dairy products. However, at this moment, we have probiotics products of all kinds. We have beauty products, pet foods, cleaners, specific tablets, lozenges, drops, everything you can think of. I think there is a probiotic variant of it. I know not everybody who is watching this is Belgium, but for those who are, maybe they can recognize some Belgian products. For example, here we have the ACN Plus Wash of Yoon, an Antwerp-based probiotic company. And also next to it, here we have from Crizal, a probiotic floor cleaner. I think you already spotted also the dental products in this picture. You can see these at the right. Firstly, we have Periobalance. It's a lactobacilli reuteri probiotic, a lozenge. And here we have Probiora is a streptococci product. So let's go now from the popular products, or from a practical point, again a little bit more into the scientific point of view. And let's start with a definition that is currently used for probiotics. This definition is introduced by the WHO and says that probiotics are living microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So, very important here is that we are talking about living microorganisms. So, as every living microorganism, it's very important when you want to buy a probiotic product that this microorganism is really defined until the strain level. So, what do I mean with this? If we talk about microorganisms, they are always defined on the genus level, the species level, and the strain level. Here I put two examples for you, namely Limosilactobacillus reuteri, ATCC PTA 5289 and DSM 17938. So, however, you already heard it's a little bit difficult to pronounce. And last month it became even more difficult because before this product was really known as just Lactobacillus reuteri. So if you hear me speaking about Lactobacillus reuteri in the following slide, excuse me, it's because I'm not really used to this name. That was just introduced a few short months ago. However, you already understand with all these numbers and letters in the strain, it's really difficult to pronounce, and often a popular name is also given to these probiotic strains. So, for example, for this product, who contains these two strains, one often speaks about L. reuteri Prodentis. So, if I speak in the following slides about L. reuteri Prodentis, you know I speak about these two strains. If you look more into detail into the definition, there is also another part that is very important, and it is adequate amounts. So, in this specific products, this means that there are 10 to the 8 colony-forming units of each of these strains in one tablet. So, maybe it was already clear that I am namely speaking about one product. This means that from now on, I will mainly speak not about probiotics in general, but about this specific product, Periobalance, who contains Lactobacillus reuteri Prodentis in the dental practice. And so I arrive with the second part of my title, the dental practice. Why the hell would we use now probiotics or Periobalance in our dental practice? Or what is the idea behind this? Well, the time is really short to describe all the working mechanisms of probiotics, but the most important idea of using probiotics is this. The most well-known oral diseases like probiotics and caries are the result of dysbiosis. And the idea of adding probiotics or good bacteria is to restore this dysbiosis and to create a new balance of the oral microflora. So this is what you saw there. Okay. So now I will discuss with you some specific fields where we can use probiotics. Firstly, I want to start with my specific field of interest, periodontics. Not only because of course, I'm a periodontist, but also because periodontics are really the most research field in probiotic research and the most documented this. So if you think about the use of probiotics in periodontics, it can be used in different domains. To start with, it could be used to prevent gum disease. On the other hand, we could also use it to enhance our treatments of gingivitis and periodontitis. Let's start with the preventive part. The question we can ask ourselves there is, can probiotics prevent periodontitis? Very interesting question, because of course, no one wants to get periodontitis. However, since it takes a long time for periodontitis to develop, we should need really long-term clinical in vivo studies. And of course, since these type of studies cost a lot of money, a lot of resources, these studies are not available at this moment. Something else we could do is look to experimental periodontitis models in animals. So then we can also look in animals if this is possible. However, there are quite a lot of animal studies where this question is researched. However, sadly, there are no such studies available at this moment for L. reuteri prodentis. So at this moment, it's really not possible to say if L. reuteri prodentis can really prevent periodontitis. I think the closest we come to answer this question is with this nice study done by Uri Slagenhoff, and it's entitled "The Consumption of Lactobacillus reuteri containing lozenges improves periodontal health in Navy sailors at the sea." So for me, this is really a nice study. What did they do? They looked at 72 Navy sailors. This is a very interesting population, of course, since they looked at these Navy sailors when they were away for 6 weeks for a mission. So it's very interesting for a researcher point of view, since when we do clinical studies, we always have these discussions that there are a lot of parameters that we cannot control. For example, the food that our patients eat, and we are now more and more aware that also this may be a factor that could be implied when talking about periodontitis. However, the nice thing about this study was that all these Navy sailors were on a mission, so the food, the amount of sleep they get were all the same for these 72. And they were split up in two groups. During the mission, half of them got a probiotic lozenge twice a day for 6 weeks, and the other half got a control lozenge also twice a day. The control lozenge was just identically to the probiotic lozenge, but just without the probiotics. And now let's look to the results. So I choose to look to the primary outcome of this study, bleeding on probing. As you all know, bleeding on probing is a very good indicator of gingival health. And what do we see? That in the Aprodentis group, the bleeding on probing goes from 37% at baseline to 10% at the end of the study. In the control group, however, this number does not change. It goes from 41% and even increases a little bit to 42% after 6 weeks at sea. So, at the end of the study, there is really a statistically significant difference between the Aprodentis group and the control group. So, there was a lot less bleeding on probing in Aprodentis than in the control. Of course, it's important to notice, as I said before, for really studies for really to see if probiotics can prevent periodontal diseases, it's important to have a really long-term study, and of course, 6 weeks is not a very long time. But additionally, to this bleeding on probing, the authors also described significantly lower gingival index, plaque, and also even probing pocket depth in the Probdentis group compared to the control group at the end of the study. So this is a first study, clinical study, that shows really promising results for the use of probiotics in the prevention of periodontal diseases. Okay, so from prevention, we can go now to treatment. First, let's look to the treatment of gingivitis. At this moment, there are several studies about the treatment of gingivitis. I did not put them all here because they give really mixed results. Some are really positive, some did not find any differences between the Probdentis and the control group. Concerning different outcomes, bleeding on probing, gingival index, and plaque index. However, certainly containing the bleeding on probing and the gingival index, the studies are maybe more positive than just neutral. For the plaque index, not really the difference can be found. However, there's one very interesting indication with very positive results, and it's pregnancy gingivitis. So this is again a study of Uri Slagenhoff. You see that this type of studies often come from the same groups. It's already a little bit older study from 2016. And the title is Regular Consumption of Lactobacilli reuteri containing lozenges Reduce Pregnancy Gingivitis, a randomized controlled trial. Here the authors recruited 45 women who were pregnant in their third semester and who had signs of pregnancy gingivitis. And again, half of them were given a probiotic lozenge till the end of pregnancy, and half of them got a control lozenge till the end of pregnancy. Okay, let's look again to the results. So here we look to the gingival index. I don't know why it's wrong here. The gingival index is a little bit an indication of the gingival health, looking to bleeding, to swelling, to redness of the gingiva. And what did we see? In the Aprodentis group, it goes from 1 to 0.2. So it is really an important decrease. So, sorry. In the control group, this doesn't change so much. It goes from 0.9 to 0.7. So we see again, 0.2 is significantly less than the 0.7. So in women with pregnancy gingivitis, the use of this probiotic lozenge can really diminish the signs of gingival inflammation. So, from gingivitis, let's go to periodontitis. The treatment of periodontitis, if you may or may not know, is really done in stages. This was really nicely defined in the last period workshop in 2019. And I will have a quick look at you with this before we go really into detail to the use of probiotics for this. So the first step of probiotic treatment is always behavior change, which means motivating your patient for successful biofilm removal, both with the toothbrush and dental brushes, and of course risk factor control. And if we talk about risk factor control, the most important risk factor that we can control is of course smoking. Another very important risk factor is diabetic control. So after the behavior change, we can start our cause-related therapy. Cause-related therapy, also called like the non-surgical therapy, instrumental therapy. The aim of this step is really controlling the subgingival biofilm and calculus through instrumentation. This instrumentation can be done manually with the curettes or with, for example, ultrasonic instruments. The third important step is treating those areas of the dentition that did not respond adequately to the second step of therapy. This can be done in different ways. First and foremost, this can be done surgically, by resective surgery, regenerative surgery, but this can also be done by, for example, retreatment of the gingival instrumentation with or without additional therapies such as antibiotics. And then, of course, once a perio patient, always a perio patient. So then the patient is put on supportive periodontal care for the periodontal stability in all treated patients. And this supportive periodontal care can be like a combination of all three previous steps. No, this lecture is of course about probiotics and not about periodontal therapy. So how can we see now the use of probiotics in this treatment scheme? Well, let's ask ourselves, can we use probiotics for behavior change? Well, no, I don't really see how we can use probiotics for this. Okay, let's go to the cause-related therapy. There, we really can use probiotics. And there are several studies describing this. However, if I look as a scientist to the literature, I want to go to the highest evidence as possible. And of course, this is a systematic review with a meta-analysis. And about this topic, we are very lucky. There is one systematic review with a meta-analysis that we can use. So the title is The Clinical Efficacy of Probiotics as an Adjunctive Therapy to Non-Surgical Periodontal Treatment of Chronic Periodontitis. So I put here the aim. I won't read it loud for you. You can read it yourself as you will. But I will just go to the important part. So if we talk about a systematic review, we often talk about a PICO question. This means that we look first to the patients we are interested in, the P. And this is chronic periodontitis patients. Of course, this is a study before 2018, because now we no longer talk about chronic and aggressive periodontitis. But I think most of you still know what chronic periodontitis is. All right, let's go to the I. The I is for the treatment that we want to compare, and this is of course probiotics as an adjunctive therapy to scaling and root planing. The C is for the comparison of the intervention, and then this is just scaling and root planing alone, or of course what we would prefer, just a placebo. And then we look to the O. The outcome is a pocket probing reduction, or the cal gain. Okay, so in this systematic review, 4 studies about Aprodentis could be included. The study of Vivekananda, the study of Wim Teugels, my former boss, and then 2 studies by the group of Yilmaz, this study and that study. Okay, what they all had in common, they were randomized controlled clinical trials, so they had the highest evidence for clinical trials for looking into a product or an intervention. They all included 30 to 40 patients. The follow-up ranged from 42 days to 1 year, so there was a big difference. And they all had in common that they used Prodentis twice a day. However, the time that they used the Prodentis ranged from 2 weeks in the Vivekananda and the Turkish studies to 3 months in the KU Leuven study. So let's look again to the most important outcome of interest, the overall pocket probing depth reduction at the short term. With this, the short term, I mean just after stopping with the probiotic. So this is different for all studies because for some this is after 3 weeks, for some this is after 3 months. So this is the classic way to illustrate this in a systematic review of forest plot. And I know there are a lot of numbers here, but the most important thing to look at are here, and we see that they favor the probiotic group. So in the probiotic group, there was almost half a millimeter more pocket probing depth reduction than in the control group. Well, of course, half a millimeter, that's not that much. However, you have to keep in mind this is half a millimeter in the whole mouth, and of course there are also pockets that were already shallow at the beginning. But maybe nice to compare it is the pocket probing depth reduction in the short time of antibiotics. This I took from a very recent study, also a systematic review, and we see that the pocket depth reduction of probiotics are in the same line as the antibiotics. Of course, to be really certain if this is really comparable, we should directly compare these in a randomized controlled trial. Even maybe more interesting, because we often talk about overall pocket probing depth reduction, is looking to the pockets we are really interested in, because these are the pockets of 7 millimeter and more, because as a dentist, as a periodontist, as a dental hygienist, you know that these deep pockets at the beginning of a root planing, those who are 7 millimeters or more, are really the pockets that maybe won't close after just instrumental treatment. So if we just look at these pockets, the pockets that are really have a chance to be in need of surgery after the initial therapy, we have another forest plot. And here we see that the mean difference is even bigger. So in the probiotic group, the Prodentis group, we have almost 0.7 millimeter more pocket probing depth reduction than we have in the control group. And I didn't say this before, but both for this and for the other outcome, this difference is highly statistically significant. Also here I put the comparison with the antibiotics, and you see it's maybe a little bit less, but it's still in the same line for both of them. Maybe more interesting because pocket probing depths for you, it is maybe already something difficult to grasp, but for the patients, it doesn't say anything. What is more interesting is that 2 of these studies also describe the need for surgery. And this is something very important for patients because for us, periodontal surgery is just periodontal surgery. It's not that big surgery, but for patients, it's often a dreaded treatment, and they say, "Oh, surgery, no, I don't want that," or "What will be the result?" So it is very interesting to see that the need for surgery at the end of the study was significantly less in the study of Periodontal for the Aprodentis group, so only 67% of the patients were in need of surgery versus 87% of patients in the control group. And the same was found in the study of Tikshe. In the control group, after the scaling and root planing, all patients needed surgery. However, in the group that also got the Prodentis tablets, only 80% was in need of surgery. So the need of surgery was significantly less in both studies for the probiotic group. So this is something very tangible for the patient. However, maybe you already saw it. This is a study of 2016. A systematic review is mostly not written in a few weeks or a few months. So this study is, we can think of maybe of 2014, 2015. So it's already 5 years old at least. So we can ask ourselves, are there not more recent studies about this topic? Well, there are. There's one study that is described in 2 articles, and it's written by the group of George Spilikos, who is now working in Hong Kong. So the first study of the two just describes the effectiveness of probiotics again as an adjunct to scaling and root planing. So he looked to scaling and root planing and versus scaling and root planing plus Prodentis. In this study, the patients took the probiotic product for 4 weeks, twice a day again. However, no statistically significant intergroup differences were found. So no differences were found between the probiotic and control group. However, one should be aware that, in my eyes at least, were this really periodontitis patients? Because if we look to the baseline numbers, the mean pocket probing depth was only 3.1 millimeter in the probiotic group and 3.5 in the control group. So this means if this is really the mean probing pocket depth, these patients did not have really a lot of pockets. So I think the author realized himself, and he did a new he wrote a new article just looking at the smaller size with deep pockets. And as I already said before, the deep pockets are really the pockets we want to look at too, because these deep pockets are really the pockets that will stay in need of additional treatment even after just instrumental treatment. And what did he find? No, well, no, he did find statistically significant differences. He found a better pocket probing depth reduction in the Prodentis group, statistically significantly more clinical attachment gain, and also more pocket closure. This pocket closure is something, it's not quite new, but now it's more and more something you see more and more in scientific literature, and it is like a percentage of the pockets that were there before, but then after treatment that were closed. Those pockets that did not need any further treatment. Okay, so now we reviewed all the information about probiotics in the cause-related therapy. So we can go to the second step of therapy, where we treat the non-responding sites. One way to do this is, of course, surgery, and for this there are not really probiotic studies available. But another way to do this and which is often done in dental practice, but not really so much described in literature, is a reinstrumentation. And here we have one study, a study I know very well myself because it's one I did myself, and it's about the use of a dual strain Lactobacillus reuteri probiotic, so Aprodentis, of course, in the treatment of residual pockets after scaling and root planing. So, what did I do? I looked for 44 patients. In all these patients, I did a reinstrumentation, and afterwards, these patients received half of them Prodentis twice a day for 3 months, or a control lozenge that was like identically to the probiotic lozenge, but just without the probiotics. Okay, let's again look to the outcomes. And as I said before, in periodontitis studies, the most classic outcome is pocket probing depth. So the packets went from 3.1 millimeter at baseline at the intake of the patients to 2.6 millimeter after 3 months. In the after 6 months, sorry. In the control group, they went from 3.3 to 2.9 millimeter. So if we compared the outcomes of the Prodentis group to the control group, and also the difference of the pocket problem depth reduction, the Prodentis group did significantly better than the control group. Also here, as I said before, pocket closure is something we look at now a lot. And also the pocket closure, this was after 12 weeks, but let's look after 6 months. We see that 67% of the pockets that were there before reinstrumentation closed. And in the control group, this was only like a good 50%. So statistically significant more pockets closed in the Prodentis than in the control group. And then let's go to the last step of therapy, the supportive periodontal care. Also there's a quite recent study by Grusovin entitled The Clinical Efficacy, also here, of Prodentis lozenges in the supportive therapy of general periodontitis stage 3 and 4 grade C. So we see here now, this is a more recent study. We have now the staging and grading system in place since 2018. And they present their results 1 year after the study start. So here, 20 patients were recruited. So, okay, this was rather a small study group. And a guided biofilm therapy was done. So this means that where there were still deep pockets, the pockets were instrumented subgingivally, and of course also the supragingival biofilm was removed. And also here, the subject half of the subjects received probiotics tablets to be used twice a day for 12 weeks, or the control tablets. Again, we look to pocket probing depth, and we see in the Prodentis group, the mean pocket probing depth go from 2.2 millimeters to 1.8 approximately, and in the control group we have the same number, 2.2 millimeters mean pocket probing depth, and they go to 1.9. So you see already at first sight this is less than this, but after statistical analysis it is clear that this is really a statistically significant intergroup difference between the Prodentis and the control group. Of course, a healthy mouth is much more than only periodontitis, and there are also other indications to use probiotics. Well, there is also encouraging evidence that probiotics can be used in the prevention of caries. This study by Stenson followed 113 patients that were given probiotics up to 1 year. So they were given to the mother when she was pregnant, and then to the baby when he or she was 1 year old. Here, it were probiotic drops containing L-Reuteri 80 cc 55,730. And this was initially given for allergies. And then at 9, when the children were 9 years old, they were recalled to look at caries prevalence. And what did they see in the probiotic group? More children were caries-free, and this was a rather big difference, 82 versus 58%. And the prevalence of caries was lower. So there was also encouraging evidence concerning the prevention of caries. And there is also one interesting study in adolescents where they looked to early caries lesions. So 36 adolescents were recruited with early caries lesions, and again they were given probiotics or control lozenges twice a day for 12 weeks. In this study, in the Aprodentis group, there was a significant decrease in time concerning fluorescence measurements. However, in this study, there were not really intergroup differences. Another interesting indication that is described is the effect of Aprodentis on oral Candida in frail elderly. So this is a Scandinavian study where they looked to 215 elderly, and they looked really to the Candida counts. And also here again, the patients received twice a day probiotics or control lozenges for 12 weeks. And they looked to the prevalence of the yeast Candida in the saliva. So we see again in the Aprodentis group, this decreased from 72% to a good 50%. And in the control group, this increased from 66% to 79%. So what you intuitively think is also statistically proven. So in the Aprodentis group, the number of patients with Candida detectable in the saliva is statistically significantly less than, of course, in the control group. Okay, so now we're almost at the end of this presentation. And the take-home messages that I really want to give is that it's very important that the results presented in this presentation are for lozenges with 2 times 10 to the 8 colony-forming units of L-Reuteri Prodentis. Not all probiotic strains and products have the same effect. This means just that the results of this specific strain and product can be extrapolated to other strains and products. So all results that I presented are really for this specific product with L-Reuteri Prodentis. So how can we use now these probiotics in our clinical practice? Well, it can mostly be used at this moment in the treatment of periodontal diseases. The evidence for other indications is hopeful, like the prevention of caries, the managing of Candida infections. However, there are really more studies that are needed to ascertain the efficacy of this product for these indications. So if we want to prescribe it to our patients, I would recommend to give it twice a day, in the morning and the evening, because in all these studies it is used twice a day, preferably 30 minutes after toothbrushing. So why after toothbrushing? Then you already removed the biofilm, so there is much more potential for the good bacteria to have an effect in the mouth. It's really important before you recommend this kind of treatment to do a prophylaxis and give oral hygiene instructions again, to have like the a mouth with um, less biofilm as possible before these good bacteria can do what they can do. So, really practically, this means if you have a patient with pregnancy gingivitis, recommend to use it twice a day till birth. Or if you have a periodontitis patient, also recommend twice a day for 3 months. In periodontitis patients, it is clear from all the evidence that we have that you can use it in the cause-related therapy, so it's scaling and root planing, at re-instrumentation, and even in the supportive periodontal care. So the moment that you give it is not really important. If it's really, really difficult for your patient to take it for 3 months, I would at least recommend to take it for at least 3 weeks based on the study of Vivekananda and the studies of the group of Yermas. So, thank you for your attention, and now it's time for questions. It's a little bit different than um, at a live meeting, of course. But if you have questions, you can always ask them in the chat box and we will answer them as quickly as possible. Thank you for your attention.